Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about the signs and symptoms that you can develop if you have a heart disease. These signs and symptoms can help you to find out the problem in early stages and prevent further complications. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Our heart pumps blood non-stop, 24/7 throughout our lives. Every organ depends on the heart to deliver fresh oxygenated blood to them. That's a lot of activity and pressure. So wear and tear is bound to happen, and certain activities can cause the heart to face problems at some point or the other. In this video we will not talk about specific problems themselves, but take a look at what signs and symptoms these problems might present with. This will help you to be more vigilant regarding heart diseases and identify them early on in your life. So, keeping that in mind, let's start with a simple question. What is a heart disease? Heart disease are one of the leading health risks humanity faces today. According to the American Heart Association, more than 1 in 3 adults suffer from heart diseases. And according to WHO, around 18 million people die each year from heart diseases, which is an estimated 31% of all deaths worldwide. Here we must clarify one thing: heart disease is an umbrella term. It includes diseases such as heart failure, coronary artery disease, arrhythmias, angina, atherosclerosis, and other heart-related infections, irregularities and birth defects. Now, keeping in mind that the heart plays a very crucial role in our survival, it may seem that something so serious should have warning signs, but that is not the case. According to the Center of Disease Control (CDC), 50% of people who die from coronary heart disease didn't even know they had it because of lack of symptoms. It is possible to develop heart diseases without knowing it as you go about your daily life. So it's important to know the early signs and symptoms of heart disease as well as the risk factors, so that you can get treatment early and prevent more serious heart problems. Let's first talk about what are the risk factors for developing heart diseases. According to the Center of Disease Control and Prevention, nearly half of all the Americans, both men and women, have 3 or more risk factors for heart disease. Let's take a look at few of these risk factors so that you can modify and control them if possible. Number 1. Age. Growing older increases your risk of damaged and narrowed arteries and weakens your heart muscles. Number 2. Gender. Men are generally at a greater risk of developing heart disease. The risk for women increases after menopause. Number 3. A family history of heart disease increases your risk of coronary artery disease, especially if your parent developed it at an early stage. Number 4. Smoking. Smoking is a very important and modifiable risk factor for heart disease. Nicotine tightens your blood vessels, and carbon monoxide present in the cigarette smoke can damage their inner lining, making them more susceptible to atherosclerosis. Heart attacks are also more common in smokers than in non-smokers. Number 5. Poor diet is also a risk factor. A diet that is high in fat, salt, sugar, and cholesterol can contribute to the development of heart diseases. Number 6. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, which leads to narrowing of vessels through which the blood flows. Number 7. High levels of cholesterol in your blood can increase the risk of plaque formation and atherosclerosis in the blood vessels of your heart. Number 8. If you have diabetes, this also increases your risk of developing heart diseases. Both conditions share similar risk factors such as obesity and high blood pressure. Obesity is also a risk factor. Excess weight typically worsens other heart diseases and also increases the risk of developing atherosclerosis. Number 10. Physical inactivity and lack of exercise are also associated with many forms of heart disease. Number 11. Excessive stress is also a known risk factor. A combination of risk factors may also signal impending heart disease. For example, your risk of heart disease significantly increases if you have diabetes and high blood pressure. Now let's look at the early signs of heart disease. Usually there are no signs of heart disease. It often presents unexpectedly in the form of a heart attack or other serious event. But there are few important signs and symptoms that can help you to recognize heart problems before they become serious in the early stages. Symptoms can develop that seem like mere annoyances and may come and go. For example, you may have a very short episode of heart arrhythmia, which is basically an irregular heartbeat. You can experience difficulty in catching your breath after moderate physical exertion, like walking up a flight of stairs. You can develop a sense of discomfort or squeezing in your chest that lasts for 30 minutes to a few hours. Unexplained pain in your upper torso, neck and jaw is another early symptom. A heartbeat that is faster, slower or irregular than usual can also be the presenting symptom. You can also experience an episode of dizziness or fainting. Heart diseases that involve your blood vessels are often signaled by chest pain, also known as angina, shortness of breath, extreme fatigue, irregular heartbeat. And you can also experience symptoms in your hands and feet such as tingling, numbness, coldness, and weakness. These symptoms can be signs that your blood vessels have narrowed. This narrowing, which can be caused by plaque buildup, makes it more difficult for your heart to circulate oxygenated blood throughout your body. Similarly, heart diseases caused by an infection of the heart can include symptoms like fever, shortness of breath, weakness or fatigue, swelling in your legs or abdomen, changes in your heart rhythm, dry or persistent cough, skin rashes or unusual spots. Now let's discuss about some signs of a heart attack. A myocardial infarction, also known as heart attack, occurs when the heart disease has reached at a point where blood flow to the muscles of the heart decreases. It becomes so low that the heart is unable to meet the energy demands of the muscles of the heart itself. The most common sign of a heart attack is just discomfort that includes tight, squeezing, intense pressure on your chest, which may or may not be associated with chest pain. This discomfort may also be present in your arms, back, neck, abdomen or jaw. During a heart attack you may also have shortness of breath, profuse sweating for no apparent reason, nausea, and lightheadedness. Knowing the signs of a heart attack is one of the most important things you can do to safeguard your cardiac health. Your ability to recover from one of these serious events depends on how quickly you receive treatment for them. It can be difficult to determine if you are experiencing symptoms of a heart attack. Never ignore symptoms. As normal, always seek immediate medical attention if you are concerned about any symptoms that you have. It's crucial to reduce your risk factors for heart disease. Whether you have symptoms or not, schedule regular checkups even if you think you are in excellent health. Establishing a baseline for your health will help you and your doctor address any concerns that arise in the future. Reducing risk factors and modifying your life habits go a long way in decreasing your risk of suffering from heart diseases, and also lessens the impact if you already have one. So, friends, with this we come to the end of this video. Comment in the section below and tell us what topics you would like us to cover next. We at HealthConcern are committed to bringing you the latest and updated content. If you like what we do, support us by sharing this video with someone whom you might think find it useful. You can also become a member of our YouTube channel by subscribing. Thank you so much for watching, and stay safe. The thyroid gland is a small organ that's located in the front of our neck, wrapped around the windpipe, also known as trachea. It is shaped like a butterfly, smaller in the middle with two wide wings that extend around the side of your throat. The thyroid has a very important job to do, releasing and controlling the levels of your thyroid hormone. A main role of thyroid hormone is to control many vital functions of your body, including your metabolism, and metabolism is a process where the food you take into your body is transformed into energy. This energy is used throughout your entire body to keep many of your body systems working correctly. Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about a very important hormone in our body, the thyroid hormone. And what happens when you have low levels of thyroid hormone in your body. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. The two hormones created by the thyroid regulate how much energy is being used in the body. When your thyroid works properly, it will maintain the right amount of hormones to keep your metabolism working at the correct rate. And thyroid disorders are very common. In fact, about 12% of people will experience abnormal thyroid function at some point during their lives. And an estimated 20 million people in the United States are suffering from some type of thyroid disorder. Women are 8 times more likely to develop a thyroid disorder than men. Also, thyroid problems increase with the age and may affect adults differently than children. Thyroid problems can occur when the hormone levels are too high or too low. On this basis, the symptoms of thyroid disease can be divided into 2 groups. Those related to having too much thyroid hormone, also known as hyperthyroidism, and those related to having too little thyroid hormone, also known as hyperthyroidism. In this video, we will be taking a short look at how low thyroid hormone levels, also known as hyperthyroidism, affects our body and what symptoms it can produce. Keep in mind that these are just symptoms and they are not definitive proof of the disease itself. So before jumping to any conclusions on your own, always consult a doctor for professional opinion. So let's begin and look at the 10 symptoms you can experience if you have hyperthyroidism. Number 1. Feeling tired. One of the most common symptoms of hyperthyroidism is feeling worn out. Thyroid hormone controls energy balance and can influence whether you feel ready to go or ready to nap. Thyroid hormone receives signals from the brain and coordinates cells to change their functions depending upon what else is going on in your body. Those with high levels of thyroid hormone feel nervous and jittery. In contrast, people with low thyroid hormone levels feel exhausted and sluggish. Low thyroid individuals feel unrested even though they may be sleeping more. In a study, 50 of people with clinically diagnosed hyperthyroidism felt constantly tired, while 42 of people with low thyroid hormone levels said they slept more than they used to. Feeling sleepier than usual without a good explanation could be a sign of hyperthyroidism. Number 2. Gaining excessive weight. Unexpected weight gain is another very common symptom of hyperthyroidism. When thyroid levels are low, metabolism switches modes. Instead of burning calories for growth and activity, the amount of energy you use at rest or your basal metabolic rate decreases. As a result, your body tends to store more calories from the diet as fat. Because of this, low thyroid hormone levels can cause weight gain even if the number of calories eaten remain constant. In fact, in one study, people with newly diagnosed hyperthyroidism gained an average of 15 to 30 pounds in 1 year since their diagnosis. If you've been experiencing weight gain, first consider whether changes in your lifestyle might explain it. If you seem to be gaining weight in spite of a good diet and exercise plan, bring it up with your doctor. It might be a clue that something else is going on. Number 3. Feeling cold. Heat is a byproduct of burning calories. Even when you're sitting, you're burning a small amount of calories. However, in case of hyperthyroidism, your basal metabolic rate decreases, reducing the amount of heat you generate. That's why low levels of thyroid hormone cause you to feel colder than others around you. About 40% of low thyroid individuals feel more sensitive to cold than usual. If you have always wanted the room warmer than people you live and work with, this may just be the way you are built. But if you have noticed yourself feeling colder than normal lately, it could be a sign of hyperthyroidism. Number 4. Weakness and aches in muscles and joints. Low thyroid hormone levels flips the metabolic switch of proteins towards catabolism, which is when the body breaks down body tissues like muscles for energy. During catabolism, muscle strength decreases, potentially leading to feelings of weakness. The process of breaking down muscle tissue can also lead to aching. A study showed that 34 of low thyroid individuals get muscle cramps in the absence of recent activity. And one study in 35 individuals with hyperthyroidism showed that replacing low levels of thyroid hormone with a synthetic thyroid hormone called levothyroxine improved muscle strength and decreased aches and pains compared to no treatment. Weakness and aches are normal following strenuous activity. However, new and especially increasing weakness or aching in the muscles is a good reason to make an appointment with your physician. Number 5. Hair loss. Like most cells, hair follicles are regulated by thyroid hormone. Because hair follicles have stem cells that have a short lifespan and rapid turnover, they are more sensitive to low thyroid levels than other tissues. Low thyroid hormone causes hair follicles to stop regenerating, resulting in hair loss. This will typically improve when the thyroid issue is treated. In one study, about 25 to 30% patients seeing a specialist for hair loss are found to have low thyroid hormone levels. Consider hyperthyroidism if you are experiencing unexpected changes in the rate or pattern of your hair loss, particularly if your hair becomes patchy or coarse. Number 6. Itchy and dry skin. Like hair follicles, skin cells are also characterized by rapid turnover. Therefore, they are also very sensitive to losing growth signals from the thyroid hormone. When the normal cycle of skin renewal is broken, skin may take longer to regrow. This means that the outer layer of skin has been around longer, accumulating damage. It also means that dead skin may take longer to shed, leading to flaky and dry skin. One study showed that 74% of low thyroid individuals reported dry skin. Additionally, the study showed that 50% of people with hyperthyroidism reported that their skin had gotten worse over the past year. Number 7. Feeling down or depressed. Hyperthyroidism is linked to depression. The reasons for this are unclear, but it might be a mental symptom of an overall decrease in energy and health. 64% of women and 57% of men with hyperthyroidism report feelings of depression. Feeling depressed is a good reason to talk to a physician or therapist. They may be able to help you cope regardless of whether the depression is caused by thyroid problems or something else. Number 8. Trouble concentrating or remembering. Many patients with hyperthyroidism complain of mental fogginess and trouble concentrating. The way this mental fogginess presents itself varies by person. In one study, 22% of low thyroid individuals described increased difficulty doing everyday math, while 36% described thinking more slowly than usual, and 39% reported having a poorer memory. The cause for this are not yet fully understood, but difficulties in memory improve with treatment of low thyroid hormone. Difficulties in memory or concentration can happen to everyone, but if they are sudden or severe and increasing, there could be a potential sign of hyperthyroidism. Number 9. Constipation. Low thyroid levels can put the brakes on your colon. According to one study, constipation affects 17% of people with low thyroid hormone compared to 10% of people with normal thyroid levels. In this study, 20% of people with hyperthyroidism said their constipation was getting worse compared to only 6% of normal thyroid individuals. If you are experiencing constipation but otherwise feel fine, try these natural laxatives before worrying about your thyroid. If they don't work, your constipation worsens, you go several days without passing a stool, or you begin having stomach pain or vomiting, seek medical advice. Number 10. Heavy or irregular periods. Both irregular and heavy menstrual bleeding are linked to hyperthyroidism. One study showed that about 40% of women with low thyroid hormone experienced increased menstrual irregularity or heavy bleeding in the last year, compared to only 26% of women with normal thyroid levels. Thyroid hormone interacts with other hormones that control the menstrual cycle, and abnormal levels of weight can disrupt their signals. Also, thyroid hormone directly affects the ovaries and uterus. There are several problems beside hyperthyroidism that can cause heavy or irregular periods. If you have irregular or heavy periods that disrupt your lifestyle, consider talking to a gynecologist before worrying about your thyroid. If you have any of these, do consult your physician for further evaluation. Once diagnosed, the treatment of hyperthyroidism is by daily intake of levothyroxine tablets. Your physician will decide the optimum dose by correlating your blood work and improvement levels. So friends, here were 10 signs and symptoms that may indicate that you have hyperthyroidism. To know more about other thyroid-related problems and how to manage them, stay tuned on our channel for our upcoming videos. If you like this video, don't forget to share it with your friends and family. You might just help someone who is confused about their symptoms. Subscribe to our channel for more content like this. We at HealthConcern are committed to bringing you the latest content. Thank you and see you in the next video. Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about the symptoms of blood clots you must not ignore or dangers of blood clots. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Heart attack, pulmonary embolism, and stroke all have something in common. Can you guess what it is? They occur in different parts of the body but all for the same reason, a blood clot. Wondering what exactly a blood clot is? Well, today we'll be talking about all of that. What causes blood clots? Why are they so deadly? How many types of blood clots are there? When should you see a doctor? We'll discuss all of these and more. Why are blood clots so dangerous? A blood clot is one of the most dangerous things that can happen to your body. According to experts, one person dies due to a blood clot every 6 minutes. That's how deadly it can be. The reason they are so deadly is because they can stop the blood from flowing to vital organs. When that happens, your organs will not receive the oxygen they need to function, causing them to fail. Organs like the lungs and heart start failing within 4 minutes of losing blood flow. Exercising daily can help maintain healthy blood flow. Do you exercise daily? What's your favorite go-to exercise? Share your preferences with the HealthConcern community in the comments below. What causes blood clots? You may be wondering what exactly a blood clot is. While your blood is mostly in liquid form, the clot is a gel-like clump. A blood clot can be useful when you have a cut or injuries that result in bleeding. These blood clots will block the blood vessel that has been damaged and stop you from bleeding. But when blood clots form inside your body without any reason and end up blocking your blood vessels, it's known as thrombosis. These can move quickly to other parts of your body. When they move to the lungs, they cause pulmonary embolisms. If your blood clot finds the heart, you'll probably have a heart attack. If it reaches the brain, a stroke will happen. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our followers. Stay up to date on all of our great HealthConcern content. Types of blood clots. Your blood gets help from a circulatory system that allows it to reach all parts of your body. This system is made up of arteries and veins. The arteries take oxygen-rich blood from the heart to other parts of your body. The veins return the blood from parts of the body to the heart. This gets it reoxygenated. Since there are two types of vessels that carry blood, it's only natural that there would be two types of blood clots. Arterial clots happen in the arteries and venous clots in the veins. You can also classify blood clots based on their movement. For instance, some blood clots stay in one place, forming inside the vein or artery. This type of blood clot is called thrombosis. Other blood clots travel from one part of the body to the other. This kind of clot is called an embolus. Let's talk about the arterial and venous blood clots in greater detail. Number 1. Arterial clot, also known as an arterial embolism. This particular clot is most common in the hands and feet. It also blocks the blood flow to various parts of your body. The intensity of your symptom will depend on the size of your blood clot. Depending on how much blood they are blocking, the symptoms can show up very rapidly or very slowly. Sometimes you may not even have symptoms. But there are certain signs you can look out for. One sign is a cold limb. If your arm or leg is colder than the rest of the body, it could be because there's no blood flow. If there's a decrease in your pulse rate or no pulse in your arm or leg at all, it can be a sign of a clot. It's the same thing if you're unable to move your limbs. You may also feel weakness in the same area. Another symptom of a clot is the severe amount of pain you feel. The color of your arm or leg may turn pale. You may also feel a bit of numbness and tingling if the blood clot has remained longer than expected. There are other symptoms that may show up. Blisters may appear on the skin around the affected artery. You may also see skin shedding and erosion. Necrosis is another possibility. This is when your tissue isn't getting the proper amount of blood flow and starts to die. If the blood clot has occurred around an organ, the symptoms depend on which one of them has been affected. The general symptoms to look for are pain in the particular area and decreased function of the affected organ. Number 2. Venous clot. Clots that form in your veins can build up over a period of time. One of the more serious types is deep vein thrombosis, or DVT. In DVT, the clots occur in a much deeper vein. This is compared to the other forms. When your surface veins are affected, the DVT clot can happen in your lower leg, thigh, and pelvis. But sometimes you'll even find it in your arm. The deadliest part of a DVT is when the clot dislodges itself and goes through the bloodstream into the lungs. When that happens, you suffer a pulmonary embolism, which stops the blood from reaching the lungs. This can result in death. DVT, however, does not cause a stroke or heart attack according to experts. General symptoms for DVT include swelling and pain in the affected area. You'll also feel tenderness and see red skin. If you suffer from pulmonary embolism, the symptoms include shortness of breath and irregular heartbeat. You will feel chest pains when you breathe deeply or cough. Very low blood pressure and lightheadedness are some other symptoms. The other serious venous clot is cerebral venous sinus thrombosis, or CVST. This happens in the brain's venous sinuses. This particular clot keeps the blood from draining out of the brain. This can cause the blood to leak into the brain's tissues. Symptoms of CVST you need to look out for include headache and blurred vision. You might even suffer a loss of consciousness. Seizures are also one of the symptoms. This is where you lose control of your body's movements. The more serious cases could result in a coma. When should you see your doctor? When it comes to blood clots, it comes down to the timing. As soon as you see any of the symptoms listed, you should get yourself a checkup. In fact, don't even bother calling your doctor and waiting for a response. Get yourself to a hospital ASAP. Your cells will start to die within 4 minutes from a lack of blood circulation. If you have a stroke, the sooner the clot is identified, the smaller the chance of severe brain damage. It's very important you don't brush off the symptoms. If you're having even the smallest suspicion that something might be a clot, get medical attention. You just got a 101 class on the dangers of blood clots. It's so important for you to have proper blood circulation. In fact, good blood circulation is like an antidote for clot formation. Did you know about the dangers of blood clots before watching this video? Let us know in the comments below. Thanks for your time. Don't forget to subscribe and like the video for more content like this one. Bye for now. Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about the 4 early warning signs of ovarian cancer to watch out for. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Ovarian cancer is often seen as a silent killer, but there are warning signs that come early on. It's important to recognize them. A study show that more than 70% of women often confuse the symptoms with general aging. For this video, we'll be discussing symptoms of ovarian cancer you need to watch out for, as well as various facts about the disease. Are you feeling all sorts of pain and pressure? Are you having trouble eating? What about pain and bloating? We're talking all that and more. Before discussing our first symptom, let's quickly go over what ovarian cancer is. Ovaries are female reproductive glands that produce eggs or ova. They are also responsible for producing the hormones, progesterone and estrogen in women. Ovarian cancer occurs when abnormal cells in the ovary start multiplying out of control, and eventually form a malignant tumor. If ignored or left untreated, the tumor can spread out to other parts of the female body. Just like any other disease, ovarian cancer also has some early warning signs. Unfortunately, these symptoms are quite unclear and can be easily dismissed. You need to know that the ovaries are made up of 3 different types of cells, each of which can develop into a different type of tumor. Germ cell tumor, this is developed in the egg-producing cells of the ovary, and is quite rare. Stromal tumor, this one's developed in the hormone-producing cells of the ovaries. Epithelial tumor, this is the most common form of ovarian cancer. It develops in the outer tissue layer of the ovaries. Now that we know exactly what the concern is, it's time to get familiar with signs that can help early ovarian cancer prognosis. By recognizing these symptoms, you may have a fighting chance at treating the disease before it advances out of control. Number 1. Persistent pressure. If you've been complaining about pain in the abdomen, pelvis, and lower back for 1 to 3 weeks, it can be a sign of ovarian cancer. But don't get scared just yet. This can be associated with several other conditions. Your best bet would be to talk to a doctor. Getting it checked out will help narrow down the possibilities. If the pain increases while your stress levels are high, this could be your problem. If your pain eases after making some changes in your diet, it can be related to a gastrointestinal disorder. It's quite hard to differentiate between the symptoms of ovarian cancer and basic health concerns. You might need to consult a specialist if you can't find relief on your own. Do you experience abdominal pain? How do you treat it? Has it gone away? Sound off in the comment section and start a conversation with our HealthConcern community. Number 2. Difficulty eating. Loss of appetite is also a common symptom. Several ladies might find it difficult to eat just a small meal. Again, it's not necessarily due to ovarian cancer. This is what makes things the most difficult. But why is it necessary to keep tabs on these signs from the initial stage itself? Even with extreme advancements in medicine, there is presently no screening method for identifying ovarian cancer in women who are asymptomatic and do not have a family history of the disease. Several survivors will tell you that symptoms for ovarian cancer detection are few and far between. Women can show symptoms months before their diagnosis. Ladies need to pay attention to how long these basic symptoms last. Looking for accurate answers on common health and wellness issues? Hit that subscribe button and join our followers. Stay up to date on all our great HealthConcern content. Number 3. Bathroom trouble. If you have the uncontrollable urge to pee as well as pain in the bladder, it can be a sign of ovarian cancer. Usually, it's simply mistaken for a peeing tract infection. If these symptoms last more than a few weeks, you should get in touch with your gynecologist immediately. Even changes in your bowel habits, specifically constipation, can be an early symptom. Did you know there are distinct causes of ovarian cancer? Let's take a quick look at some of the common aspects that might increase your risk. Hormone therapy and fertility, drugs, genetics, obesity, personal history of colon, pee, or breast cancer, and aging. You need to understand that having these risk factors doesn't necessarily mean you will develop cancer. A woman can be diagnosed with ovarian cancer without experiencing any of them. Bloating. Bloating is defined as the uncomfortable feeling of heaviness or fullness in your stomach. Women usually experience this during their monthly cycle, however consistent bloating for more than a few weeks can be a reason for concern. Also, if this bloating is accompanied by swelling, it's a red flag. Now you may be asking, are there any other symptoms I need to watch out for? Other small signs can be things like acid reflux, weight loss, fatigue, and menstrual changes. Most of these symptoms are temporary and respond positively to basic health treatments. However, if the symptoms persist, there are high chances of them being associated with ovarian cancer. The problems become more severe as the tumor grows. By the time you understand the need for medical attention, cancer spreads outside the ovaries, making it harder to treat effectively. We would suggest you consult your doctor if you are experiencing any new or unusual symptoms. So what are some ways to detect symptoms? You'll be surprised to learn that only about 20% of ovarian cancers are detected at an early stage of the disease. If found at the right time, 94% of the patients can live for more than 5 years after diagnosis. Let's take a look at some of the methods. Consulting a specialist. By the time you consider ovarian cancer to be a cause of your illness, the tumor has sometimes already spread. Some ovarian cancers can rapidly spread to nearby organs. Careful and timely attention to symptoms can improve the probability of early diagnosis and receiving successful treatment. It's best that you report your symptoms to your doctor right away. Pap test. Pap tests, or HPV, can be used to detect ovarian cancers at advanced stages. You should discuss the need for these exams with your healthcare professional. TVUS. This is short for transvaginal ultrasound. It's a common screening test used to detect ovarian tumors. The one problem is that it can't successfully confirm whether or not the tumor is cancerous or harmless. CA-125 blood test. Confused? This is used to measure the amount of protein CA-125 in the blood. Usually, women with ovarian cancer show high levels of CA-125. Gastrointestinal evaluation. Physical tests such as an endoscopy or colonoscopy can also help with ovarian cancer detection. But only to a certain extent. Don't worry, better ways for screening ovarian cancer are being looked at. Right now, these are the only known methods. All types of ovarian cancers are curable if the patient receives a diagnosis at an early stage. Some are also treatable at later stages, but your best bet is with early detection. There are several other signs you shouldn't ignore when it comes to ovarian cancer. Have you or someone in your life dealt with ovarian cancer? Let us know in the comments below. Thanks for your time. Don't forget to subscribe and like the video for more contents like this one. Bye for now.